Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story
Just launched by an East Bay fertility doctor.
This week's episode is a very special one. Our dear friend and colleague, Dr. Ban, is interviewing Dr. Amy. We're excited to be able to share this conversation with you. It's a fun introduction of what to think about regarding your fertility and an overview of IVF and egg freezing, and Dr. Amy is answering questions from listeners. Let's get on to the show.
I'm going to introduce everybody, and then Dr. Amy is going to. Okay. So, for a lot of people who are not on our community, I want to introduce ourselves. I'm Dr. Bond. This is Van. She's our CEO and our Weightless for Life. She's our heart and soul of our Weightless for Life community. And so usually every month on on a Saturday we do a live coaching, and so we help people with question on weight loss, how to look at medication on diabetes, obesity, non-alcoholic, whatever condition you have question how to eat things, what food you want. You do that on Saturday. So most time we do that, but we always have a special guest with us, and usually we go with our special guest for half an hour with just question and answer, and then after that we go on to question from our community. So we'll do the same thing today, but for you, those of you who do not know us pretty well, is that what Van and I try and do here is that as we get older, we notice that people gain weight and start feeling a lot of fatigue. And in addition to that, you don't have the same vigor as you do when you're younger. And so what we try to do is show you different techniques that you do to help reverse a lot of those issues, okay? And so if you think about, and it has a nice link to it because it leads to a topic with Dr. Amy, and the topic is looking at being a family and being parenthood. So you really have to think about your overall health before having a family, what happened during that process, and what happened to you after that. And so it's a nice link. And so I'll introduce, and you jump in anytime, okay? So Van's smarter than I am, so she'll jump in anytime. And so, we've known Dr. Amy about 10 years, and we're very fortunate. And I'll give my close friend, Dr. Matt Reckenwald, this because he and I were colleagues in the emergency department, and he introduced us to Dr. Amy, and Dr. Matt is a wonderful physician, still love him to this day, and I think he's one of the best ER docs. But he introduced us to Dr. Amy, and so Dr. Amy is well known, right? So I'm like we're a little mouse compared to Dr. Amy because she's been around and speaks like to conferences. She's been on Oprah, she's been on Arco. Anytime they have an important topic on reproductive endocrinology, fertility, she's the expert, and people travel the world to see her. And so her training is, she received her bachelor at UCLA. She went to medical school at Harvard. Woo! And at her fellowship at University of Michigan in reproductive endocrinology and infertility. She's been practicing about 20 years in San Ramon, and we love Dr. Amy, and we'll tell our story a little bit later on. Once you talk about the balls technique, I'll tell you something that you probably never heard me say this, and nobody ever heard it before, but I'll be the first one to tell you. Okay, so we're gonna spotlight you. Our AV person extraordinaire want us to ask you, where would you like us to have your information on social media, things like that? We can do that for you, okay? If you want us to put you on any, he said, Ask Dr. Amy. Social media, YouTube, website, whatever you want us to do, let us know. We'll put it on the chat section on the side so people know. And so here's Dr. Amy. So first question, I have a list of questions that, I know you have to leave by 10 because you have a very important birthday to go to, okay? So I have a list of questions for you, but you teach us, okay? You're the expert. So the question to stop you from doing what you're really good at. So tell us the state of the fertility for men and women and in the current day and age.
Absolutely. I know it's kind of silly to say that it's a really exciting time to be a fertility patient because no one wants to be a fertility patient, honestly.
Yeah.
When you're struggling with fertility, you're a little hopeful and then you're really anxious, you get frustrated, you're really angry. And it happens every time you see your period start. And then certainly anytime you say, I want to get pregnant, you have to deal with the possibility that it may not work or you might have a miscarriage or other complications. Mm-hmm. But there's so many tests out there now that people can do, and a lot of them are even do it yourself. I mean, you can start off by doing a sperm kit at home without asking a doctor and being afraid that they might say no to you. Yeah. And there's so much technology available now, and treatment success, they're as high as ever. So what I tell people is, if you want to see a fertility doctor, it doesn't necessarily mean you also want to do treatment. Because I think that's a big barrier for people, is they feel like if they go see a doctor, it means they have to start spending lots and lots of money and putting themselves in treatments that may not work. But what I tell people is go see somebody, get your tushy checked, and get your sperm checked. Yeah. And I'll talk a little bit about what I mean by that. And then learn more about yourself so that you're not spending wasted time trying something that's just never going to work.
I love that point because that's the one, honestly, that's the one thing I always think about when I have a lot of staff that come and talk to me about, and it just through a conversation, I said, you don't realize, and I remember Van telling me this when she was 32 being a high profile lawyer, and her physician said, hey, when you going to think about kids? And I remember Van, I'll talk about, we're so offended. Like, as kids, we are in the prime of our time. We're top of our career, right. But then next thing you know, 5 years go like this. Right. And next thing you wish you have spoken to somebody, understand all the background, what you should have been doing all along. So now we tell people hey, you're early 30s, you better think about these things. So I love that point because a lot of people think that by talking to you, I'm going to have to go to a procedure. It doesn't mean that way. Tell us about freezing eggs and things like that for working women. And I have a lot of friends who are in that category.
Yeah, I mean, I think egg freezing, when you look at the marketing slogans that some companies are using, it makes you feel like egg freezing is perfect and it's insurance and it can secure your future fertility. But what I tell people is egg freezing can only secure future options, and it's not a guarantee. And there's no such thing as having it all. You can have it at different times, but you can't necessarily have it all. And this thought that there's control that you can really have on your fertility, that's just misleading and misguiding. So I want everyone to learn about freezing your eggs, because if you learn about egg freezing, then you're learning about your fertility. And I want every single woman to think about it by the time they're 32 years old, especially if you want 2 kids. If you're 37 and you have 1 kid already, I want you to think about it. And I don't think as doctors, I think we're missing out on an opportunity to teach people about freezing their embryos. So we talk a lot about egg freezing, and you see a lot of social media posts about that, but no one's screaming except me and maybe a few other doctors about freeze your embryos. There's so many fertility myths, and one of them is get pregnant with baby number 1 and then baby number 2 will be easy. And that's just not true. And even well-intentioned doctors are telling their patients that, just get pregnant with your first and the next one's going to be easy. So I see patients, they come to me at 37, for example, and they wait 3 years and they're like, no, but my OB said it should be easy the next time. And now we realize it wasn't. So I tell everyone at that 6-week postpartum check, talk about, how many kids you want, when are you going to do that? What are your fertility levels? If you did IUI, for example, with the sperm, freeze that sperm. It's so easy to freeze sperm. Don't wait till the sperm is older, less viable. You would want to use sperm from a younger age.
So the first thing that you taught me so far is age is a big factor, right?
Mm-hmm.
So age and fertility is like two things that's going to affect you. And,
Right.
And can you break that down, Amy? You know,
Yeah, I mean, there's really three things. It's age, environment, and genetics, right? And so the genetic piece we can't control. The age piece we can control in that we can choose when we want to have a baby. But a lot of those things, those factors, like they're social. And sometimes it doesn't feel like you have a choice. And you're pushing things to extremes. You know, I see so many patients over 40 who are doing 4, 5, 6, 7 IVF cycles just for that one golden egg. Mm-hmm. And then there's environment, and environment has a lot to do with what you guys teach your patients, and that has to do with lifestyle. And certainly there are other environmental factors that are out of our control. For example, what's in our water, what's in our cosmetics, what's in our water bottles, for example. So those three things, you know, as we're pushing the limits as far as age, you know, talking about these things early, even when someone's 25, you know, I want people to get their fertility levels checked by the time they're 25, or even younger. If, for example, they had a tourist ovary requiring it to be removed, endometriosis, a family history of maybe their mom used IVF for them. So those are the kinds of things that are so important to talk to a doctor about, or just, you know, there's so many websites now. You don't even need to talk to a doctor to basically get a fertility questionnaire and, you know, go through a questionnaire to see if you might be at risk of having fertility issues as you get older.
I think when it comes to the age, what are some hallmarks, you know, that you normally look at? Because I remember in my early 30s, you know, when my OB said, you know, you got to start looking at it now. But of course, I was just focused on my career at the time, and you know, we weren't even thinking about having kids. But there are certain age, I guess, hallmarks that, you know, mark certain declines in fertility, and it makes it more and more difficult to have children. And I think a lot of people don't really understand what those hallmarks are, and they think that they can always have that option well into, you know, pushing 40. So can you tell us what those age points are?
Absolutely. And I blame Botox for it. I do, because people look in the mirror and they're like, I look amazing, so I must be fertile. And certainly you do look amazing, but your ovaries is a different story. So, you know, it's just really hard to get pregnant over the age of 37. Really, really hard. Each egg has about a 25% chance of being genetically normal. That's really low. And then at 40, each egg has about a 10% chance of being genetically normal. So when I have a 40-year-old patient, I tell her that 90% of women will not be able to have a pregnancy with their own eggs at 40. And that's shocking to people, because they're like, well, I just thought if I saw you and I did IVF, it would work. So people think that as long as they can do IVF, they will be successful. And IVF isn't magical. We can't create more eggs for a woman as she's running out. And so there are some women, for example, who start running out even at 30. And that's why I always advocate getting your fertility levels checked, let's say before you start birth control pills, and maybe even once a year, because birth control pills, not just Botox, but birth control pills also trick women into thinking that they're fertile because your cycles are always regular while you're taking the birth control pills. So 30 years old, each egg is has about a 50% chance of being genetically normal. Wow. And then it just goes down as we get older. And certainly the level checking that I'm referring to is a hormone called anti-Mullerian hormone. And it's not a perfect test, but it's the best that we have. It's a diagnostic tool that tells us when a woman might go through menopause. And we know for a fact that it gets really hard to get pregnant naturally, or even with treatment, as you're getting close to that age at menopause.
The other thing I want, can you give us like what are some of the main like issue with fertility in men and women? So like what are things they have to think about? You know, and we talked about this in the past.
Yeah, I mean, aside from age, certainly it's lifestyle, right? So body size, you know, making sure that from a medical standpoint, your blood sugar is normal, your blood pressure is normal. It's not so much about a BMI. Mm-hmm. But I like to check levels just like you do. You know, look at what your hemoglobin A1C is, look at what your cholesterol is, see what your blood pressure is, and then have goals. Because it's really hard. It's easy for someone to say, just go lose weight. But what does that mean for that person?
Yes.
And we know that a semen analysis is like another vital sign for a man. So you can look at someone's semen analysis and kind of predict maybe what medical problems they have. Not always, but sometimes. And so those are the kinds of things that are important to check in a guy, for example, if he has a sperm issue. And then for women, certainly fibroids, endometriosis, tubal issues. Those are big things that I deal with, as well as recurrent pregnancy loss. So women who have multiple miscarriages, that can be from a genetic reason. It can be from an anatomic reason, like an abnormality in the uterus. And all of those things can be seen, for example, on ultrasound or through blood tests.
Wow. Okay. That's good. The one thing that you mentioned earlier was about freezing the embryo. Mm-hmm. So tell us a little bit more about that process, because I don't think people can sort of visualize what that means.
Absolutely. So IVF is the process of collecting eggs, making embryos by fertilizing each egg with sperm, and then you grow the embryos out, and then you freeze them. And then there's no such thing as freeze or burn. You can use one now and then come back to me 2 years later, and then come back to me 2 years later. I actually have helped families who came to me over 10 years ago who now have literally 4 children from doing that. So for example, they'd come to me in 2008 and say, Amy, I want 3 to 4 kids. And then we did enough IVF cycles to make sure that they had enough embryos for them to reach those goals. And then over the year, they reached that family size goal for themselves. Most people don't want that large of a family, but there are some people that do. So for example, if someone came to me at 39 and they said, I want 4 kids, I would have to ask, well, how would you get there? Because the only way to really get there is if you had enough viable eggs to go through IVF now. Otherwise, you're looking at other really great ways of having a family, like egg donation, embryo donation, or adoption. So I always ask people, what do you want? What is it going to take to get what you want? And are you willing to do it? And it's really important to know what your diagnosis is, because without that, you wouldn't be able to answer that question.
Yeah. And talk to them about a little bit of how to go through a cycle of retrieving eggs.
Absolutely.
Yeah.
So it's a 2-week process, and it's basically injections of hormones every single night during that period of time, and visits to my office for ultrasounds and a blood draw. So it's on average around 5 visits from start to finish. Starting point is around when your periods start, and the finish line is that egg retrieval procedure, which is done while you're asleep in an operating room. And it's a small needle, it's a needle puncture that's done on one side, right and left, in the vagina to aspirate, or pop bubbles is what I like to say. So I put the needle into each follicle. A follicle is a fluid-filled sac that contains each egg. And, egg freezing is just like IVF without the F, right? So there's no fertilizing. You go through the same process. And then 2 weeks after the egg retrieval, your period starts. But you can also choose to transfer an embryo. And there are 3 options when it comes to IVF. There's IVF with a fresh transfer, which means putting an embryo in 5 days later. There's IVF with a frozen transfer, which means freezing the embryo and putting the embryo in at a later time. And then there's IVF with a frozen transfer with genetic testing. And that's where you can test the embryos, learn more about the chromosomes, and then pick the embryo that has normal chromosomes to transfer.
Wow, it has advanced so much since we talked.
Yeah.
Now tell us about your different method that you have. Tell us about
Absolutely.
versus balls, which I'm really looking forward to hear about.
So basically, I call it the Egg Whisperer plan. Yeah. So the Egg Whisperer plan is to get your tushy checked. And the T stands for fallopian tubes. So the tubes are the embryo transport system. They're what carries the embryo into the uterus. So if a fallopian tube is blocked or filled with a fluid, pregnancy naturally may not happen. Not only that, you would be at higher risk for something called an ectopic pregnancy. The U stands for uterus. So it's an ultrasound of your uterus, and that's how you find out if a woman has fibroids. It might be a way that you can learn more about endometriosis or polyps in the uterus, or if someone has something called a Müllerian anomaly, like a septum, a bicornuate uterus, things like that. We also look at sperm, so that's a semen analysis, and certainly there are a lot of advanced sperm tests, and I'll talk a little bit about that in a second. And then checking hormones and doing a preconception panel, for example, to make sure that a woman's vitamin D is normal, her thyroid's normal, she's immune to German measles. Those kinds of things are super important before you get pregnant. And then the Y for the Tushy method stands for your genetic profile. So I like to check, and certainly every doctor is a little bit different, but there are tests that are really important to me. I like to check a patient's chromosome analysis now, and I also like to do a carrier screen for diseases like cystic fibrosis, spinal muscular atrophy are just an example of a couple of them. And then the other test that I like to do, depending on the patient's family history of cancer, is a cancer carrier screen as well. So I know I just rattled off a whole bunch of tests, and people are like, oh my God, like how much is that going to cost? Yeah. If insurance doesn't cover any of these things, you're looking at spending around $2,000, but insurance can cover a lot of these things a lot of the time. So And if they don't, like I said before, there's do-it-yourself tests that you can do that might be even cheaper than going through your insurance and ordering it from a lab. And then once you have your tushy checked, you have a personalized plan in a way, and you know more about what your diagnosis is. And then if there's a sperm issue, it's really important not to sugarcoat it and to see what you can do that's in your control to give yourself the best chance of pregnancy, no matter what the treatment is that you choose to do. So the balls method is a really simple way.
Can I pause 1 second?
Yeah.
One thing I was going to ask you, so just from me ordering lab, so when you talk about thyroid and vitamin D, can you give me like what would you like to see? So I'm trying to figure out what do I need to order from a primary care, like from a thyroid, do I need TSH, free T3, T4, how extensive, and vitamin D, at what level do I need to be?
So for me, just a TSH is a screening test. And if the TSH level is close to 4 or above 4, or she has a family history, for example, extensive family history, then I'll do a full thyroid panel in the beginning. But if the TSH is slightly elevated or close to the high end of normal, then I'll do a full thyroid profile. So that's thyroid antibodies, free T4, total T3. And then for vitamin D, I just check a vitamin D, and I want it to be above 30, but ideally between 40 and 50.
Okay, you got it. Okay.
Yeah.
So then anything lower than 30, you would be more concerned about. You want to be more
And
the
same
optimal range. Okay.
And same with thyroid. I feel like we're over-treating women who do not have a thyroid condition. And people are looking at things that they're reading online, and they're freaking themselves out over a TSH of 2.6.
Yeah.
And the reality is that there are other reasons why this person is having a hard time getting pregnant. Because if your TSH is 2.8 or 3.2, that's not it. Unless you have Hashimoto's or, an autoimmune form of a thyroid disease. Yeah. So then if the sperm count is on the lower side, I created the balls method because I see guys come in all the time and they're told, well, it's low, but it's really good. And I'm like, huh? But my sperm is low, but my doctor said everything's fine. And I'm like, what? And so I was like, this just has to stop, because I'm always saying the same thing over and over. Well, these are the things that you need to think about. And so background genetics of the sperm is one of them. And so there's something called a sperm DNA fragmentation test that I order for guys who have low sperm quality. Getting an anatomy check, and I don't do the checking under the hood. I send patients to a urologist to do that. There's several urologists in our area. So it's to make sure that the guy doesn't have a varicocele, for example. And then we talk about lifestyle, and lifestyle would be like no smoking, exercising most days of the week, including weightlifting, no THC at all, and moderate to low consumption of alcohol, especially if someone's BMI is high. Then at that point, I say, please just no alcohol. And then when it comes to labs, I like to do the same types of hormones that I do on women, on men. So we check testosterone as well, estrogen. I also check thyroid, vitamin D, sometimes even prolactin, FSH, and LH, because if the count's really low, then sometimes you might learn that there might be similar to like menopause for women, men can have andropause, or a term called testicular failure when the FSH is really high. And then the other thing is sex. I mean, just talking about it, how is it going in the bedroom, and bringing that topic up, because a lot of times some of the issues related to not getting pregnant could be because people just aren't having sex anymore because the desire isn't there, or it's very, very stressful. And so it's important to talk to your doctor about that, because there are medications you can take. There's sex therapists that you can see to kind of resolve that issue. And there are also home insemination kits that I give to patients to help them with that. So, talking to someone about all these things is really important so that you can kind of figure out what exactly is the problem so you can fix it and come up with a plan. Then once you have your tushy checked and your balls checked, then, I say, now you're ready for the egg whisperer diet. And it's not a diet. It isn't literally like, a meal plan, but it's my formula for IVF success if you need IVF. So in order to have the D, you need to have your diagnosis. So before you do IVF, it's really important to have an idea as to what's going on so that you're prepared and doing everything you can to give yourself the best and highest chance of pregnancy. And then the I is IVF. The E is endometrial testing. So make sure you're looking at the uterus really carefully. And the T is your transfer. And then within that is your fertility team. And so the way I think about it is I have like the tushy here, the balls here, you got your diet and the team right here, bringing them all together. And the team is therapy, exercise, eating, acupuncture, and meditation. So those are the things that I talk to my patients about on a daily basis. And I came up with this method or plan for people out there who don't have me as a doctor so that they can hopefully learn from these tools no matter where they are.
Oh, I love it. I love how organized you are. I'm like, wow, I love it. And, the one thing I was going to ask you, it's prolactin for men. What am I looking for? Like, what am I thinking? Sorry, that one just, I sort of knew for women, but then the guys.
It's the same thing for guys. So it can affect the secretion of hormones like FSH and LH in a man. And that signaling to the testicle is really important, and it needs to be normal. So if that hormone is not balanced, then a guy might have a lower sperm count than expected. So similar for a woman, if their prolactin is really high, the signaling FSH and LH to the ovaries can be abnormal, and then a woman might have a hard time ovulating in a normal way and secreting enough progesterone for a pregnancy to implant.
And how about like vitamin D for guys too? Same issue, or you don't?
Yeah, I mean, there is some evidence to suggest that low vitamin D in guys might cause lower sperm quality. Mm-hmm. And then for me, I mean, I'm meeting people at the prime of their lives, right? They're in their 30s on average, 40s, even 50s. And I want these people, because they want to be parents, I want them to live forever. Yeah. I don't want to hear stories of a patient of mine who was diagnosed with a breast cancer or early Alzheimer's. And that's really actually the more important reason why I check vitamin D in my patients, mm-hmm. is because there is some evidence to suggest that low vitamin D is linked to early onset or earlier onset of dementia, Alzheimer's, as well as breast cancer. And then the other thing that concerns people and me is potentially a higher risk of autism if a woman is pregnant and has really low vitamin D. Mm. So just because I'm saying this doesn't mean it's so, but there is some literature to support these theories. And so, checking a vitamin D level is so easy, and taking vitamin D, especially when it's just an easy thing to do.
Yeah. And it's interesting because, I check vitamin Ds all the time in my mm-hmm. patients. Some of them are older, obviously, but it'll be shocking to that most of my patients, the vitamin Ds are in the 20s.
Yeah.
And even mine. That's why I was like, what? I'm so dark. How can it be? I'm like in the 20s. And I don't even use any sunscreen, as you can see.
Yeah.
But, I was going to go back to what I was talking about, the Ball State methods. Is I never even actually mentioned anybody, and I'm not embarrassed to say this, but, when you think about fertility and things like that, we always assume that's women issue. Mm-hmm. But for us, it was actually me, right? Mm-hmm. When you and I talked about this about some 8 to 10 years ago, and it was actually the sperm count. And I remember you're saying, wow, 40%, it's not going to get there, buddy. It's not going to get what you need to be. And I was thinking, hey, I do P90X like every day. Look how ripped I am and stuff like that. But reality is like, that doesn't really show your sperm count and the quality of the sperm. So I think that's really the one thing that guys forget is that, and it goes back what you were saying before about Botox, is like just how you look outside. It doesn't mean that the rest of you is going to do the job it needs to.
Right. Your fertility isn't skin deep, and you can't judge a book by its cover. Easy things to remember. And getting a sperm test now is as easy as ordering something off Amazon and hooking something up to your phone. That's how easy it is.
Yeah. No, I like that. Now tell us about your Egg Whisperer, your podcast you do every Wednesday. And I'm like, wow.
Yeah, I mean, I basically have a studio that's not far from my office, and I go there every Wednesday, and I film a topic that comes to my mind based on, let's say, questions that people are emailing me, asking me, and I think that would be of interest and help people along in their journeys. And I just talk basically for about, on average about 20 minutes, and I hope I don't embarrass myself because I've had a long day and I have no idea what, sometimes songs come out of my mouth, sometimes I rap a little bit, and then I have, that show basically gets turned into a podcast so that people can listen to it on their own time, whenever they want. And then I also write an article that goes with the podcast too, for people who would rather read more about it and click on links to learn more about the different topics. So that's available too.
Yeah, it's amazing. And I love the fact that you love to help people with a family, because not only mm-hmm. do you talk about your own clinic, but you bring on a lot of people that are expert in the field, and you collaborate with them and really explore all the different options, which I love about what you do, and the one thing that we learned from Dr. Amy is that like every family she started is like her own family, and the children she have is like her own kids. So, that's the one thing we admire a lot about you. So we love that part about you. When I see your podcast, I'm just like in awe, like how did she have time to do this? And how that Dr. Matt's so lucky to have you.
Yeah, I don't know if people know how we met. I mean, you worked with my husband in the emergency room, and then You guys were at our wedding, and you're family to us. So I'm so glad to be on the show today.
Oh, I want to tell a story about Dr. Matt and I.
Mm-hmm.
So I was always the night doc, and I remember coming into the small hospital that in southern Sacramento. That's where they have all the L&D and postpartum. And I remember Matt came on, and he's like, "Hey, I'm leaving. I don't have anything for you." So I go to see him. It's 11 o'clock at nighttime, so I go see my patient. Then I get this whisper like, "Hey, doc, somebody got to the door, and they didn't make it to labor and delivery." I was like, "Oh, great. Now I got to deliver somebody out of their car." So I ran over there, get to the car. It was like a tiny little car. And I see this person in a green scrub, and I grab his shoulder, right? And I pull him out. And this giant of a man, right? So Matt always told me he's 6'7". I think he's 6'9". He comes up, he stands up like this little Civic, and he comes up this. I'm like, "What are you still doing here?" I was like, he was out there delivering the baby. And so I always think of that story about him and how great. And that's how we sort of got a chance to talk about this one special love in Matt's life, So that's how we met Dr. Amy.
Yeah, that's very funny.
So how do people get a hold of you?
I'm super easy to find. So my website is draimee.org. So dramy.org. And there's a contact link, and you can send a message through that. You can also email me directly, email@eggwhisperer.com. And of course, you can ask me a question. If you're watching one of my YouTube shows, for example, you can post a question there, and I'm always happy to answer. And I also have an app coming out very soon, probably in the next 3 months. It's called the Egg Whisperer app, and it has a very thorough fertility questionnaire in there. So you can fill it out, and then I can guide you based on the information that you share with me and give you more of a direction so that you can take that to your doctor. It's not necessarily meant to replace your doctor's guidance, but as a guide, so you know what questions to ask.
Oh, I love that. I think that it's just more accessible for people, and I love that because everybody likes the fact they can have a sort of a quick answer, and if they need more, they can always contact you. And so the podcast is every Wednesday at what time?
Every Wednesday between, I go live at 7. And then the podcasts are just always on, you can find them on Spotify or whatever method you choose to listen to your podcast. It's basically posted everywhere on iTunes, Google, everywhere. Yeah.
And then you're also on Twitter. And,
yeah, absolutely. Yeah.
I see you tweet all the time, so I love that. Twitter and also Instagram. So any question out there from I know we talk quite a bit, but so you can ask question via the chat, so people can click the chat, ask us question here, or if you want to raise your hand and I can put you on and ask question. We're going to have this. Oh, here it goes.
Okay, so we have a question, and it says, does going through pregnancy reduce the risk of breast or uterine cancers?
Yes, and the answer is there are certain cancers, or having a full-term pregnancy can reduce a woman's risk of having breast cancer and uterine cancer. So the answer is yes, but yeah.
Anybody else have any questions for Dr. Amy?
I have one in the meantime. One of the things that you mentioned was the social aspect. So there's genetics, there's age, and then there's the social or environmental. And you mentioned briefly a person's body size. So, that was one of those things that I didn't realize, as well as that weight could really impact the chances of having a child, fertility, and so forth. Can you speak to that a little bit more?
I can, and I never want to body shame anybody. So I love my curvy patients, and I'll help and support all of you. So you are welcome to come in no matter what your body size is. And you will notice when you see me that I'm going to track your levels and balance out whatever the abnormalities are. So if for example, your blood sugar is high, we can still work on that and help you have as healthy a pregnancy as possible. But at the same time, and at the same time, I'll also educate you about what the risks are in pregnancy. So I think people need to realize that if your BMI is very high, you're at higher risk of having a baby with autism. You're at a higher risk of having a preterm birth. with preterm birth comes other issues, like you might deliver the baby before the baby's even viable. And if a baby's preterm, the brain is smaller of that baby and won't get enough oxygen, and there might be developmental abnormalities as well associated with that. There are also other more catastrophic or serious issues. For example, preeclampsia. So preeclampsia is a very dangerous hypertensive disorder in pregnancy. And the only cure oftentimes is delivery of that baby. And if delivery needs to happen before a baby is full term, then you have all the complications associated with prematurity. So I'm not saying this at all to, make people scared, but education is key. So we prepare for going on a cruise, for example, more than we do for pregnancy in this country. So if you knew these things and you would say, I'm going to go see a doctor to just make sure I'm getting checked out, and see someone who won't shame you, see someone who's going to help you and be a team member, just like the two of you are for all my patients.
Well, there's a more question for you.
Okay, great. Thank you. Let me just ask a question from Rachel here. If you have a low AMH, are there supplements that can increase quantity and quality of follicles?
Yeah, so AMH is a hormone that's secreted by cells that surround the egg. So the higher the AMH, the higher the egg count. So if I have a patient that has a low AMH, I do believe that there are supplements that can help with egg quality. And I ask patients to start them as soon as they've met me. And I think every woman should be on CoQ10, for example, until she's done having her kids. Our naturally occurring CoQ10 levels in our body start to go down at 30. And that's when you start to see abnormalities in embryos and eggs increase at a higher rate. And so taking CoQ10 as young as 30 could potentially help someone, I think, theoretically, even when they're 37 or 38. And there isn't like a magic amount of time that a woman should be on it. So starting it right now is great, but it's not like you should be on it for 3 months and expect to see results. You should start it and then, continue to try and get pregnant. Some doctors like the hormone DHEA. I talk to patients about individually what I recommend for them based on their goals, their age, their antral follicle count as well. And then there are a bunch of other things that I also recommend. So pterostilbene is one of them, acai berry resveratrol, and another supplement called NAD. And certainly I have an article that I've written on my website about egg quality supplements. I don't necessarily want to bore people going through all of them right now, but you can certainly go to my website and then put in the search section, supplement egg quality, and you should see it there.
On the DHEA, how much usually are we talking about?
Usually 75 milligrams per day, and this is only for women. I've seen men take it, and they should not take it because it can be converted to testosterone and reduce the sperm counts. So depending on a woman's body size, if she is on the smaller side, I recommend starting at 25 milligrams and then check your DHEA and testosterone levels once a month while you're on it to make sure that your testosterone levels aren't going up, because that can be detrimental to the eggs, in my opinion.
And the other quick one is on CoQ10. Remember, people that are on statin medication, that will lower that even further. So that's one thing you have to be mindful as well.
Okay.
Yeah.
Yeah, that's good to know, especially for my male patients. I have more male patients who are on statins than female patients.
Okay. And then Nancy asked a question, what's your website? And you said it was draimee.org. That's DRAIMEE.org.
Yep.
And then also, can I see you before my embryo transfer to have a checkup? Is that something you do?
Yeah, I mean, I absolutely do. So if patients have embryos at another clinic and they just want to get my perspective on my approach in their situation, they absolutely can do that.
Okay.
So yes.
All right. And do you take insurance?
I don't take insurance. I'm so lucky to have a very busy practice, and because of the number of humans and lives that I touch each and every day, I'm not able to, but I do have a process where we give you the super bill so you can file a claim with your insurance directly.
Great.
Perfect.
Okay. Any more question? Thank you so much for being. I know you got a great party you got to attend to. Thank you so much for being on today too. These are great information. So what we'll do is we're gonna gather with Matt, and then we're gonna put it out into social media, and you let me know how you would like us to do that as well.
Awesome. Okay.
And Amy,
well, thanks.
we love you.
Yes.
Your family to us too.
Well, I want to come to the Twin Dragons opening. You have to let us know when that is. Please.
So they get pretty excited when they hear your name. So yeah. They got a little bit bigger too. So
I love
it. Come see you too.
I can't wait. Okay. Yeah. I'll see you guys later. Thanks. Love you.
Bye-bye.
Bye.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Amy.
She's known as the Egg Whisperer.
Fertility expert Dr. Amy Abazadeh.
And you have yet another success story.
Just launched by an East Bay fertility doctor.